2014 has been dubbed the Year of Telemedicine. Dr. Ash Collins of Telemedicine Australia, along with Professor Anthony Mader of the University of Western Sydney, are both working to ensure that dream becomes a reality. But first, what is telemedicine, and how will it affect our current healthcare access?
So telemedicine is really a subset of telehealth. Telehealth is a generic term, and this really means delivery of healthcare services at a distance where the patient and the clinician might be separated in time, in space. So telemedicine is that part of it which is really clinician to patient type activity. So if a doctor has a consultation by video conferencing, for example, that constitutes telemedicine.
Professor Mader has a research lab at the university where he is busy developing technologies to assist with the treatments. One gadget is this data glove.
It's a normal glove like a cyclist might wear, but it's got special wires running down it which can sense the position of your fingers very accurately. So the idea of having this very fine, detailed, digitized knowledge of where the fingers are can translate into, for example, a doctor explaining to a nurse how to position his or her hands on the patient, or help somebody rehearse a procedure that they're going to do on a patient.
4 hours west in Temora, New South Wales, and Dr. Ash Collins is also working on ways to make life easier for those seeking treatment in rural areas.
One of the services we have in Temora is providing telemedicine services for people from Riverina. People travel from closer towns to Temora, also Temora, come to the practice. They have a referral from their own GP to see a specialist, or there are new patient who requires to see a specialist. If that particular specialist cannot be found in the local area, Wagga Wagga, then obviously we need to get the support of the specialist in bigger cities such as Sydney or Melbourne.
Dr. Collins has helped produce equipment such as this camera, which he is demonstrating can seek out a freckle or mole and project the image to the specialist via computer for evaluation. Other equipment includes this tablet designed specifically for diabetes sufferers.
And it's meant to connect the far-end practitioner to a patient at home. The device does video conferencing with the far-end practitioner from the patient's home.
The device allows the patient to test their lung capacity through this machine, with results processed immediately through the tablet. While many are supportive of the developments of telemedicine, others warn about the hidden dangers involved with using ICT technology. Russell Smith of the Australian Institute of Criminology in Canberra has had many articles published on the topic of cybercrime and telemedicine.
You know, as you know, the benefits are enormous in being able to deliver medical services remotely. And so you need to balance up the risks of some of the consequences, which could be quite serious.
Mr. Smith feels there's still a long way to go before we can fully endorse telemedicine.
It is one large piece of material that criminals can use to commit identity crime. So knowing a person's background, their personal history, that can form part of a package of information to create a false identity, and then get access to people's other, bank account information and other things.
Professor Mader, on the other hand, still maintains that the future is looking bright for telehealth technologies.
Sure, this is the golden age, because it's like when the banks decided to go to ATMs, radically change business. So going to a more IT, a more information-driven environment in healthcare will change a lot of things that have become rather embedded and slow to evolve.
Victoria Pearson reporting for CheckUp.